The topic of our presentation is anxiolytics. The list below include all anxiolytics divided into the categories of benzodiazepines, non-benzodiazepines, antihistamines, and a residual category. The medications in red will be the ones covered in this presentation. Hydroxyzine is a medication commonly known as Vistaril. This drug falls under the class of therapeutic drugs. It is an anti-anxiety and antihistaminic drug. Common uses of Vistaril include treatment of anxiety, preoperative sedation, and use as an antihistamine. The therapeutic uses of this drug include decreasing allergic symptoms associated with histamine release, sedation, and anxiety relief. This drug acts as a CNS depressant at the subcortical level of the CNS. Some side effects for this drug include drowsiness, agitation, dizziness, headaches, weakness, wheezing, dry mouth, bitter taste, constipation, nausea, urine retention, and chest tightness. Nursing considerations and teaching points for this drug include instructing the patient to take the medication exactly as directed, cautioning the patient to avoid operating any heavy machinery while taking the drug, advising the patient to avoid the use of alcohol in combination with this drug, suggesting gum or hard candy for dry mouth, and assessing the patient for severe sedation and providing safety precautions before and during the administration of this drug.
Clonazepam is a drug commonly known as Klonopin. It is in the anti-anxiety class of drugs. It works to enhance the GABA activity in the central nervous system, which is the major inhibitory neurotransmitter in the central nervous system. It is used as an anti-anxiety med as well as an anticonvulsant in individuals with epilepsy. It relieves panic attacks and reduces seizures. It can cause dizziness, somnolence, problem behavior, depression, and upper respiratory infections. The percent of individuals who have these issues is listed above. Finally, patients should avoid activities that require mental alertness. They should also be careful if the drug is used long-term, as this can cause withdrawal effects if stopped abruptly. Also, the patient should not drink alcohol while taking this drug.
Chlorodiazepoxide, also known as Librium, is found in the anxiolytic and sedative class. It is used for the management of anxiety and alcohol withdrawal. Side effects include dizziness, drowsiness, pain at the IM site, disorientation, orthostatic hypotension, rash, tachycardia, blurred vision, and decreased libido. The mechanism of action is that it acts at many levels of the CNS to produce an anxiolytic effect. It depresses the CNS probably by potentiating the GABA, an inhibitory neurotransmitter. Nursing interventions include assess for anxiety and levels of sedation, institute fall preventions, and institute seizure precautions. Patient teaching includes that it may cause drowsiness and dizziness, avoid the use of alcohol, and not to share medications.
Lorazepam, or Ativan, is a benzodiazepine. It potentiates the effects of GABA, a powerful inhibitory neurotransmitter, producing a calmative effect. It is used for anxiety disorders, anxiety symptoms, pre-operative sedation, acute alcohol withdrawal symptoms, and insomnia. Possible side effects could be ataxia, the lack of muscle coordination, paradoxical excitation, meaning the opposite effect of what would be expected, blurred vision, dizziness, and drowsiness. You should instruct the patient not to stop abruptly because it could cause withdrawal symptoms. Advise the patient that lorazepam is usually prescribed for short-term use and does not cure the underlying problem. Assess the degree and manifestation of anxiety and mental status prior to and periodically throughout therapy.
Flumazenil, or Ramoxicon, is a therapeutic antidote. Its uses are to reverse benzodiazepines. Its actions are to antagonize the CNS depressant effects of these drugs. Side effects are dizziness, nausea, and vomiting. Nursing interventions to consider are to assess the level of consciousness and respiration status before and during therapy. You are to observe the patient 2 hours after administration for resedation and hypoventilation. Patient teaching includes: do not consistently reverse effects of benzodiazepines. This means that sedative effects may occur. Avoid driving for 24 hours and no alcohol or non-prescription drugs 18 to 24 hours after discharge.
Buspirone, or Buspar, is an anti-anxiety drug that works a little different than other anxiolytic medications. It binds to serotonin and dopamine receptors in the brain and increases metabolism of norepinephrine. GABA is not involved, and there is very little addictive potential. There are also no withdrawal effects with Buspar. One reason why Buspar might not be prescribed often is because it can take several weeks for the therapeutic effects to kick in, which contrasts from the immediate effects that benzodiazepines have. Some notable side effects include dizziness, drowsiness, fatigue, shortness of breath, nausea, insomnia, weakness, blurred vision, chest pain, and sore throat. Make sure the patient is not currently on any MAOIs because the interaction with Buspar may cause hypertension. Also instruct the patient to not use with alcohol. Large amounts of grapefruit juice are not recommended for patients on Buspar because it can have a toxic effect by increasing the amount of Buspar the body absorbs. Instruct the patient to take exactly as prescribed. Follow-up exams are also necessary to determine effectiveness of the medication. Buspar may cause drowsiness and dizziness, so teach the patient to not operate a vehicle or machinery until the effects of the medication are known.
Kava kava is an intoxicating pepper. It reduces anxiety, stress, insomnia, and benzodiazepine withdrawal. It alters the limbic system modulation of emotional processes.